Hey everybody, Trainee here from the Department of Learning Health Sciences at University of Michigan. And today's module is Standard Setting to Ensure Trainee Competence. I would like to acknowledge CIRHT, the Center for International Reproductive Health Training, in recognition for funding this work. Let's go ahead and get started. Before I do get started, though, I would like to acknowledge that this program was nearly fully adapted with permission from Dr. Rachel Yutkowski of the Department of Medical Education at University of Illinois at Chicago, who created and graciously shared a slide deck, and I am grateful for this, so passing on her wisdom as well based on a framework that she has developed. So the agenda for this module is I'm going to review two different methods used to set standards for performance assessment. We'll walk through a specific example that is commonly used as a process to set standards, and we'll also along the way review considerations associated with standard setting processes. So let's begin with, we need to understand that this whole standard setting process is associated with defensibility. And when we set standards, it's not done in an arbitrary way. And what we are doing ultimately is capturing expert judgments to determine a cut score on a test. And how we do that, there's many different ways. But in spite of that, the whole process does require a great level of commitment and time, and it will always involve some decisions and judgments, and therefore we are relying on judgments of a panelist, not a single human, where they must estimate performance level of the candidates who are taking whatever test that we're talking about. Because of this, we must make decisions about the actual panelists in the standard setting processes. We need to select panelists that are familiar with the students, the curriculum, and the test. And because these experts are providing these judgments individually, then we're going to take their scores individually and summarize them across the other judges, typically done with an average. And this process is used for eliciting judgments, and it actually gives judges sometimes, give or take, not in every situation, performance information. We do it with and without. And then we also have group discussion and revisions of judgments based on what the discussion is. So there's a little bit of flexibility along the way, but for the most part, processes are fairly consistent with some nuances. Now, one thing that we need to understand going forward is the difference between relative and absolute standards. On the left, we have a relative standard, which is based, we talk about normal curves. Well, here we have a normal bell curve, and so hence we call it grading on a curve. Let's take an example. Let's say I have a learner, and that learner is here on the scale. We see the star, and they're hitting, let's say, 65% on whatever this test is. Now, in a normative-based standard setting, or a relative standard setting, this person will pass because the scores and the pass rate is based on or dependent on the performance of their cohort. So yay, this person would pass. Okay, great. The other folks would not pass. Okay, fine. This has been commonly used in education and medical education alike. The pros are that faculty and learners are comfortable. They're used to this. The cons are that the pass-fail decision is learner-dependent, clearly, because it's based on the whole cohort. So if everyone is performing poorly, you might ignore underperformers. Okay, now let's switch to this absolute side, and this is criterion-based, sometimes called domain reference grading. Here is our person again, our learner, also at 65%, same person. Here is our passing criterion. Let's say we've set this through a standard setting process. What happens to this person? Well, they're not going to be happy. they're not passing. And oftentimes in criterion-based standard setting or absolute standards, more people do not pass. It's just the nature of the beast. And so that's something to take in consideration. The benefit or the pro with this is that it does help identify underperforming learners, which is nice. But again, as I said, the con, increased failure rates. And oftentimes it creates more work for faculty because we have to take action to remediate or make sure that the underperformers are addressed. Okay, so when do we use these different standards? Is it relative or absolute? Well, we can kind of make that pretty easy. Relative is when you're trying to make decisions about how many students can I admit, how many students can I promote, how many students can I remediate. Now that is a relative ranking of sorts, and so that's something to think about. Now when we talk about our own medical students and we're talking about competence, and here we are talking about performance assessment, because that is our target. We want to know how much is good enough. Well, do you want to have junior learners setting the standard for the pass-fail rate, or do you want to ensure that your learner is competent? Let's make sure the learner is competent. Okay, so taking these into consideration, we have steps associated with standard setting. Now this is quite simplified, but there are 5 steps: from prep, selecting standard setting methods, compile the rating data, discussing and reviewing, and then dissemination and reporting. For a higher level detail of these individual steps, I do have a handout 1, that is available, so I will refer to that, and certainly you can pull that out. We're going to start with prep. Okay, now first thing we need to think about, really, or the primary thing that we need to think about, is selecting expert panels and the expert judges that are on the panel. As I discussed earlier, the panel needs to be, or the judges need to be familiar with the students, the teaching, and the assessment of particular skill or performance that the learners will be targeting. Also understand that you are choosing a panel. You're not choosing individuals. Even though individuals will be doing the rating, you really want a panel to offset the experiences and the expertise of that entire panel. And so individually they work themselves out. Generally panels are not tiny. Ideally we are talking 6 to 15. And they must represent stakeholders. Best judges are willing to contradict the group and challenge the processes. They do add a level of complexity to the discourse. However, I find that having these folks, you sometimes need some outlier. You sometimes need some aha moments said by a bold person in the group. So I do appreciate that. Those were the do's. The do not, I'm going to point this out fairly heavily. Do not select judges out of convenience or personal agenda or familiarity with the coordinator. This happens many times, and I'm just going to point out that this may not be the best option for your expert on your panel. Okay? Now, you've selected your judges, your 6 to 15 judges and whatnot. Next step is selecting the standard setting method. We'll be spending a lot of time in this section, so let's go ahead and get started. So, there are a number of commonly used methods. However, for the sake of our talk today, I'm going to be focusing primarily on item-based or ANGOF and test-based or Hofstee standard setting methods. I'm going to incorporate the training of our experts within this process, and within the standard setting, we want to make sure we do train our experts. We want, going into standard setting, we want to ensure that judges fully understand the process used to set standards. They fully understand the rubric and the performance categories or response options. And we also want to ensure judges understand the consequences of scoring. That's quite important, all for the sake of producing defensible standards. When we talk about training, like I said, we'll actually walk through an example exercise where we compile the data. So we're a little bit, I'm joining these two groups because they go hand in hand. When we train, we actually do an exercise of the actual practice. So if I were there with you in together, I would say, okay, let's walk through this process. What I'm going to start with is the Angoff method, which again is the item-based standard setting process. And what we want to do is we're basing this on projected performances, performance score of the borderline student. And what do I mean by that? Here we have this pink zone, and are they passing? Are they not? It's that student that will maybe pass. In language that we use is barely pass. The student who has a 50-50 chance of passing versus failing. So that borderline student, that's who we're targeting during the Angoff process. Now, when we talk about this exercise, we're talking about, and we're going to focus on a single question. What's the probability a borderline student would accomplish each item? Then we're going to sum the probability across the items, and we're going to get to a score needed to pass this particular case or whatever that test might be. Let's contextualize this a little bit. So in a simplified setting, this might be a little bit easier. Let's say we have a 4-item test. It could be a checklist. It could be a multiple choice quiz, anything along those lines. The critical component is we want to get to that question. What is the probability of a borderline student accomplishing this item? The easier the item, the higher the probability this borderline student is going to accomplish this item. So looking through this, item 1, fairly easy with an 85% chance that that borderline student is going to accomplish this item. Scrolling down these numbers, we see that number 4 is the most difficult likely, and this particular judge, if this were me, that means I am not confident that many of these borderline students would pass, and in fact, of item 4, and in fact, only 15%. So then we have that. What we do is we sum these. I've actually added all of these things, these probabilities up, and the sum is 2. We divide it by the total number of items, which is 4. And the passing score that I project for this borderline student, a minimally competent student, is 50%. Okay, now, what do we do if we have a rating scale? Well, then we talk about what rating would a borderline student receive. It might be a neutral, it might be an agree. Now, in certain settings, if this were a mastery model and everyone knew this was a mastery model, then the minimum would be an agree. So the expectation is a pass of agree is the accepted minimal competent borderline student would receive after training. Now, if you have different progressive models, such as milestones, different items might have different standards and different ratings. So this is something to consider, and that's why we look at these individually. So we see that these could fluctuate quite a bit across these response options. So that's something to consider. We're going to walk through an exercise. Let's try it together. Okay. Now, this is what you're going to need. You're going to need worksheet number 1, which is supplied. You'll also need the eclampsia checklist, which is the performance checklist. It's nice to have that in front of us. And a partner or 2 to practice and co-judge. You can pause this video now and you can watch this together. You know, that's the flexible nature of having a video. So let's go ahead and get started. As a facilitator, I need to contextualize the setting. So if you are going to facilitate a standard setting session, you need to offer a foundation for your standard setting judges, your experts, your panelists. Okay. So in this case, I've selected a performance assessment in a simulated setting where the patient presents with eclampsia. Okay. So the encounter, I'm setting the stage with the case. This happens to be a 41-year-old G1P0 at 38 weeks. She comes into triage complaining of a headache, and ultimately it looks like she seizes during this evaluation, and potentially this is a woman presenting with eclampsia. Okay, now we also need to know the target. In this case, I'm going to say it's a resident, maybe OB-GYN, maybe this could even be emergency medicine, this could be family medicine, could be really anyone. What their task is is recognizing and managing patient presenting with eclampsia per the performance checklist. So you're defining what the target is, you're defining what the basis in the rubric is by saying checklist. Now, a little bit more information on the checklist is it's with the simulated base scenario. We have an 11-item checklist that we see here. Most are dichotomously scored, yes or no, and we've got one global rating as well. So if I were walking through the eclampsia case, okay, we do a little bit of warm-up. Everyone has their worksheet, so the cohort sitting there waiting to be guided. We ask them to read this, and we are trying to define the borderline student because that's what the Angoff process tells us to do. We are focusing on that borderline student. And I would ask them, my colleagues individually, to ask them what distinguishes the student from a solidly passing student. And so in this example, let's say I have a colleague that says a borderline student would fail to successfully complete some tasks, while a solidly passing student would not fail to successfully complete any tasks. So some tasks would not be successfully completed. Okay? Now, item B, what distinguishes a student from a clearly failing student? So we have the top and bottom of these. A borderline student may attempt tasks without success, while a clearly failing student would not even attempt a task or tasks. Okay, so this is going to be discussed as a cohort, finding out where are we defining the borderline student. We define that borderline student as a group. We write it up on a whiteboard. So everyone knows what we're talking about on the borderline student. And sometimes this does take discussion. It almost always takes discussion. So that's hashed out before we actually go into the standard setting. So we have these things. Now we move on. Let's say we've had the discussion about our borderline student. We've defined it. Now we're faced with the second worksheet, okay? What we do is we look at the items, and I'm focusing on this first set of the blank spaces. What is the probability that a borderline student will accomplish this item? We see the trend here. That's what we're going for, okay? Just like that initial example. And I, as an individual, go through and make some decisions. I really think that everyone is going to call for assistance, so I say 100% or 1, okay? I'm going to go ahead and look at these things all the way through, but so if you've had this run before and you're doing a second run of standard setting, you will be supplied these numbers on the right. If you don't, then you don't use them and you continue along their way. If this is a second run, you may look at these numbers on the right-hand side and it might influence some of your decisions. So for example, I may stop just like I did here on item number 4, and I might initially say, wow, I think I have the borderline student at 50% successfully passing all of these components in this particular item. And then I look at the actual percentage of who successfully performed it, and the actual on the last run was 28%. So I may take that down a little bit and then move on. And then I add them up. My total is 6.75. So me as an individual rater, I'm done. Then I move on to my small group. We're all sitting there working individually, and then we come to the group discussion. And we have a conglomeration of all of your colleagues, and let's say we have 6 judges sitting around the table. And here's me and my 6.75. That's my raw cut score. Okay, now everyone else around the table is going to do their thing. I've got my colleagues that are adding their things. Okay. And what I'm doing is I'm going to calculate the average raw cut score, or A, and I added it up. That's 45.2 divided by, again, the number of items, 6, and that is 7.53. Well, we're not there yet. So what I do with that 7.53 is I divide it by the total number of items times 100, and I get 75.3 as my minimal passing grade for a minimally competent student. Take some practice, and before you do any standard setting, I would suggest that you have your raters walk through this process. You walk them through and explain the process, okay? Pretty straightforward, but it gets, you have to kind of get into it a little bit. Now, are we done? Not really. But before we move on to the secondary process, I'm going to show you a little bit about the Hofstee process before we talk more about the considerations that apply to both of these processes. Now, as a reminder, the Hofstee is a whole test based. It's absolute, and yet it takes into account existing scores, combines the normative and absolute judgments. And what we're doing, the judges make 4 actual judgments: the minimum and the maximum acceptable passing scores, the minimum and maximum acceptable fail rates. Those are 4 different scores. Then we average those across judges, just like we do with the Angoff. And the results are then plotted on a graph of actual learner scores. This is a little bit different, and we'll show you what that means. And then we intersect with the plot, and that becomes the pass score. So let's go ahead and move forward. So here we have, as I said, the existing actual scores. So this does require you already capturing data from your students, so a second run. And I'll explain later the importance of this iterative process, and this is partially why. These actual scores are informing us for this Hofstee method. So what we have done is we do the same standard setting, and we have a minimum and a maximum pass score using the judges' cumulated scores and average scores. We do the same process as we did, but we're asking the 4 questions. So let's say in our case we have let's say it's a 10-point scale, and we have a minimum pass rate of between 5 and 6%. This is what we have adjusted. Okay. That being said, then we have the minimum and max fail rate. This is a percentage. Okay, so now we're getting this intersection. The fail rate, let's say, is between 30 and 10%. This intersection here, we have that red line. Now we're getting to the intersection of the min and max fail rate with the normal data between 5 and 6, which comes out to be the intersection 5.4. Okay, a little bit more complicated, but what it does is it takes a more objective approach in incorporating the actual scores of previous student runs. So that being said, you can try it. This is where you get your drawing skills in a little bit, your drafting skills. You'll need a ruler. And again, you want to do this with a partner or two to co-judge with you. And this is an exercise that you can walk through similarly, and refer back to the video to check out that process. Now, this is where I'm going to go back to common processes in both cases. Okay, so regardless of method, there are some subjective processes, and there's that goes into this, and so there's discussion and review based on these types of things that we'll talk about. Also, in this handout that I've provided, we do want to talk about content validity. We want to give the judges, our panels, an opportunity to inform us about the items. Perhaps we find, for example, item number 1, we have call for assistance, and 100% of the students pass this. Do we think it's critical? Well, if we think it's so easy, it may not be critical. Okay, so we run down this entire thing looking at these and rating them in the same way. When we talk about the probability of the borderline student, we take that in consideration as well. But predominantly, we want to find out what is critical about these items. Do we need to remove any items just for the efficiency of the assessment based on the probability, the borderline probability, as well as the actual? The other thing we talk about, which you'll see in this document, is that we want to make sure that the rigor of the standard setting process is high. And so we have a check back mechanism. For example, we want to identify how clear was the purpose of the test. Well, we're hoping it was very clear. Same as the characteristics of the borderline examinee. Now, that's fine. That's totally happy. We may have issues, though. Let's say we're getting some, potentially orange zones, which means, it's not terrible. How clear were the rating tasks to be performed? I'm saying clear. I may not be saying very clear, but it's still good. How difficult was it to provide the ratings? If it was difficult, I'm still okay with that. Sufficient time to provide the rating task. Too much time? That's okay. Now, where we start having trouble and where content validity may be threatened is when we start getting into these sure questions that may raise red flags, and so then we have some rigor issues and may have to go back and revise our standard setting process. For example, in item 6, do you think the final passing scores are appropriate for examinees? If it says too high or too low, that could be a problem. We really want it to say just right. 7, how confident are you in appropriateness of the cut score? Not confident. That is truly a problem, and so we might have to go back and there may be a little more discourse. Now, as you see below in the comment section, we do expect when there's discourse involved that your examinee judge panel will write comments to initiate the discussion. So moving on, the importance of this, and it seems pretty clear, I think, through this process, is that the standard setting process is iterative. We will start by doing individual item ratings in the large groups, and then you discuss the outliers, and when possible, you provide the performance data and the consequences associated with passing and failing, and then there's a revision if they want. And so that is a critical component of this process. And then every year when you have new data, you really ought to go back and do it again. And so it becomes part of your QI process and your assessment process. Not everyone does this, but if you want to ensure rigor, especially in the high stakes consequences, this is something that should be considered. Now, that being said, I can't ignore this whole issue of compiling evidence and documentation, but you also need to create some documentation, especially that standard setting is iterative and it's also organic. So there is definitely a need to update and maintain the supporting evidence and the documentation, especially again for the higher stakes setting. So particularly if there's credentialing or promotion decisions tied to these measures and decisions, you should be prepared to perform standard setting every year, like I said, and follow with, most importantly, transparent reporting of the processes and the cut score. It takes a little bit of practice, but if we apply these best approaches for standard setting, it really does help to ensure the long-term value of your program and simulation and the related assessment programs. And it ensures defensibility and the practical performance assessments value, and ultimately improve and maintain the best possible patient care. So that being said, here are some references. Certainly you can use that QR code to get to the eclampsia checklist based on ACOG. And so that is there as well if you prefer to use that. I know we can't click on this when you're watching a video, so there's the QR code. Thank you. There's my contact information if you need any help or have questions.